I thought I'd do an extra video this week on the topic of goal setting. Goal setting is infused within my ebook and certainly has its place within creating behavior change. Here's my perspective on the matter, which will give you some insight about the terms I'll use in future videos. While there's a societal draw to being goal-driven and focusing on the achievement of goals, there's a current movement that embraces process orientation as a valid method to feeling successful. As a health practitioner, I turn to the growing discourse within the health field around setting goals and how to distinguish the terminology accordingly. Conventional terminology states that goals fall into two categories: process-oriented goals and outcome-oriented goals. Process-oriented goals are activities or tasks that one takes to make progress toward a particular concern. The fundamental idea is to approach the goal setting in a way that it creates building blocks for healthy habits. The habit takes shape by setting process-oriented goals, which allows the client to continually progress toward the desired outcome. Completion of each process-oriented goal can be viewed as a success in and of itself, while contributing to a larger goal. Allowing the client to feel the benefits of what it's like to succeed is integral to building confidence and keeping the client motivated. Process-oriented goals often come in the form of answering the question, what is something I can do right now toward my goal? These kind of goals can be measurable and time-based, as in setting up daily or weekly tasks for an aspect of your health concern. Process-oriented goals can help move the client into action. They are clear, doable goals that a client can take immediately. And what about outcome goals? Simply stated, an outcome-oriented goal is a larger goal. It's a goal that describes the end result of what the client wants. Outcome-oriented goals come in the form of statements like, I want to have, or I want to be better at. They are broad and speak to the improved condition that the client would like to be living. Such statements are most effective when posed affirmatively, rather than using words like don't or not within the stated goal. Outcome-oriented goals are like aspirations that can expand the horizon and push the client out of his comfort zone. They can be inspiring and motivating for the client to set his sights on the big picture. On the flip side, they can be overwhelming if there's a perception that progress is not being made toward them. This is a key area where the client will need to take accurate inventory of his efforts and the progress he's making.